Welcome back to another episode of PolYneer's podcast. And today, we'll be diving into the diagnosis process.
That's right, Hasin. Doctors usually depend on imaging tests, such as X-rays, CT scans, and MRIs, to diagnose lung cancer. If these tests show any indications of cancerous growth in the lungs, further testing will be required to confirm the diagnosis.
I see. So what happens afterwards?
Then the doctor may perform a biopsy, which involves removing a small amount of tissue from the lung for examination under a microscope. Although it might be uncomfortable, it is necessary to obtain an accurate diagnosis.
That sounds daunting. But when do patients usually experience symptoms of lung cancer? And is it easy to detect in the early stages?
Unfortunately, patients with symptoms of lung cancer are typically in the advanced stage of non-small cell lung carcinoma, in short, NSCLC. NSCLC is the most prevalent form of lung cancer, and it often has no early symptoms, making it more difficult to detect in the initial stages.
Oh, that's very concerning. Can you tell me more about the symptoms of NSCLC and lung cancers in general?
Of course, NSCLC presents with various symptoms, including coughing, chest pain, difficulty in breathing, hoarseness, and even weight loss. If you are experiencing any of these symptoms, it's critical to see a doctor as soon as possible.
Absolutely, Vivian. It's imperative not to ignore these symptoms. Even if it's not lung cancer, it's better to be safe than sorry.
And on a different note, have you ever undergone a full-body checkup?
Yep, I try to get one every year or so. It's an excellent way to stay on top of your health.
That's very nice to hear. Did you know that regular checkups can detect early signs of lung cancer?
Really? I had no idea.
Yes. Catching lung cancer early is crucial for successful treatments, especially if you are a chain smoker or belong to a family with a history of lung disease.
That makes sense. So what can people do if they are at risk for lung cancer?
Well, the most important thing is to get regular body checkups with your doctor. Detecting lung cancer early can significantly improve your chances of survival. For example, if NSCLC is detected early, the 5-year survival rate can jump rapidly. However, if the cancer has spread to other organs, the 5-year survival rate drops to 5%.
Wow, that's eye-opening. Thanks for sharing all this information, Vivian.
You're welcome, Hasin. If you do get diagnosed with lung cancer, there are different treatment options available, such as surgery, radiation therapy, chemotherapy, and targeted therapy.
That's true. Keep in mind that the earlier you catch it, the more treatment options you'll have.
Absolutely. So if you or someone you know is at risk for lung cancer, make sure to get regular checkups and pay attention to any potential symptoms.
Well, that's a wrap for today's podcast, guys. We hope you find this information useful in identifying whether you have lung cancer, particularly non-small cell lung carcinoma. Remember, catching it early is crucial, so don't hesitate to see a doctor if you notice any symptoms.
Keep an eye out for our upcoming episode, in which we will have a special guest to talk more about lung cancer. Thank you all for joining us. Until next time, take care and stay curious. Bye!